Hello and Assalamu alaikum. Ultrascan Diagnostics. So this is the CVCT of the patient that you had requested. The area of interest is the full mouth evaluation for implants, starting with the upper central incisor region. We've got very good thick ridge underneath the spontex in the center. We've got 8 millimeters of width with a good 11 millimeters of height. Similar situation in the lateral, good bone hair, uh, 7 millimeters of width with 11 millimeters of height. Moving to the canine region, we've got slight bit of bone loss here, but if they can salvage, so we've got 7 millimeters at the apex and 9 millimeters of height, so a shorter implant will be there. But again, premolar extensive bone loss, if this can be augmented and grafted, we've got 7 millimeters of width with approximately 8 millimeters of height. The second premolar region, we've got slight bit of bone there. Um, D3 quality bone, 7 millimeters of width with 11 millimeters of height. But then when we move towards the molar region, you can see we've got absolutely no bone in the first, second molar region. 8 has slight bit of close to the tuberosity, so a sinus left will be needed. Moving to the upper left central incisor region, as you can see, close to the incisor foramen, but this is left of the incisor foramen, and we've got 7 millimeters of width, 11 millimeters of height. Then we move to the canine region, absolutely no bone here. The first premolar, we've got approximately 8 millimeters of width with 9 millimeters of height. Second premolar, we've got no bone, bone augmentation will be needed. And then the molars have no bone in the uppers either. Lower anteriors are going to be interesting. Starting with the third quadrant, we've got in the central, we've got just 5 millimeters of width with 9 millimeters of height. Similar situation in the lateral region, better bone quality, 6 millimeters of width with approximately 12 millimeters of height. The central on the lower right area, the central region has a very nice edge ridge. Moving to the lateral region, we've got very good bone, approximately 7 millimeters of ridge width with 11 millimeters of height, and the similar situation in the canine. Great bone, if the canine is extracted, you still have 9 millimeters of width with 9 millimeters of height. This is how the implants on the which are embedded in the premolar region, the molar region, and then the molar region here, very well supported by bone.